I will say that I think that goes on in most every community is there's one or two big entities that control healthcare in the region. And I will tell you, I travel all over the nation, and see all kinds of healthcare places. And it's always that way, whether it's South Dakota, whether it's, Moses Lake, Washington, whether it's Wenatchee, Washington. In all those places, there's usually one or two big entities that control the healthcare. And people are looking for alternatives. They really do. They either leave the area to seek healthcare elsewhere, or they want to find something that's an alternative. And mostly it's because they want to be involved in their own healthcare decisions. And a lot of times those big hospital type places, they don't allow that.
Mm-hmm. You're spot on. It is not just in this community or in your community. It is in every single community across the country. Mm-hmm. And I think that was really eye-opening for us as we started after that first meeting. We started getting phone calls and emails from all kinds of different people from across the United States,
right?
Looking for a job, looking for a facility to fly here to be seen or have their kids seen, because they're so desperate right now that they're not able to have or make a decision for what's best for them or for their kids or for their family members. I mean, look at a year ago. Yeah, we had friends that were that kind of really pushed us over the edges. Friends that were healthcare workers were being fired for not taking the jab or not doing this or not doing that. Friends, parents, friends. I had two personal friends die in the hospital. Nobody was allowed to go see them. So that's kind of the boiling point that Amanda was talking about. And yeah, you're right. It's across the country. So I think we have an extraordinary opportunity right now if we can all band together here to replicate a model in other states, in other areas as well, or figure out a way that we can all network together to work for specific specialties in certain areas where one state might provide XYZ surgery, we might provide urgent emergent care here, and then kind of share and network the resources and people.
Mm-hmm. Yeah, I definitely think that the need is growing. Not just the need, but also the movement is growing. And honestly, I think Jan and I have seen this for years, that those hospital systems, those big corporate healthcare systems, for the last 20 years, they have not been doing a good job of taking care of people. And we've noticed that in our community. It's one of the reasons that we've branched out of our community and all over the nation, because there are needs all over the nation and, for individualized healthcare. And these big corporate entities, they don't meet that. And they haven't for years. I think what's happened in the last 3 years is they've finally been exposed. It's all come to a head and they're like, okay, people are like, okay, I'm done with this. So in some ways, I mean, it's a tragedy. It's what's happened the last 3 years at the hospitals, especially. But it's really been going on for years. And this was just the straw that broke the camel's back. So I'm not that surprised, although I'm surprised how evil it really got. Like you say, Tyler, two friends that died in the hospital and their families not allowed to see them. I mean, that is barbaric. There is no excuse for that whatsoever.
And on the provider side, what's part of what Janet asked, we're weekly getting contacted by providers that some have left the system and some have stayed in it, and they're just looking desperately for answers. I actually had one of the functional medicine nurse practitioners that's working with us. I had her just start cataloging these providers. I mean, whether it's an oncologist or an immunologist or pediatricians or emergency room physicians, we just started getting such an influx of people reaching out to us that I was like, can you just at least start some sort of organization so we can follow up with these people?
Well, you can put 2 pharmacists on that list now.
Yes.
Please.
You'll be sooner rather than later. But we also, the hard part is that it breaks our hearts because there's so much groundwork to our ministry and so much groundwork to putting in place the right protections so that we don't have to face what we're doing if these mandates come back again, so we don't have to do this over and over again, that we're doing everything diligently with our legal team and our tax advisors and our CPAs to make sure that we're doing it right. And now we're at the starting line and we're ready to go. And it's so exciting. So it's a constant prayer for us that we do feel like, it's been said over and over again, we're going to get an influx of people who want to come work with us and healthcare providers that really want to take care of patients the way they dreamed they did when they first sat in medical school. But I also recognize that just because they would like to pull out of the system doesn't mean we are necessarily the right answer. And so that's just been heavy on my heart lately, that the Lord will just bring us the right people that want to walk alongside us in this ministry.
Yeah, that's wonderful, Janet.
No, I think you touched on something there too. It's that you do need the right mix of people, but it doesn't mean that, once you have this in place, it's something that, it's a template, right?
Yeah.
You're building a template that other people in other states or other places are able to, repeat, because it's like we don't have to, reinvent the wheel. You can go out there and, unfortunately, I think for people that have graduated or haven't graduated yet, it's very dooming right now. But this is hope, like you say in the name. It's awesome, because there is going to be, I think, more of a push. Either you stay in that system and accept what they are telling you, or you're going to jump ship over to the other side and say, no, I'm not going to be a part of it. And that as a patient or a family or a provider.
Mm-hmm.
Well, I think one thing is that this gives healthcare providers an option and some hope. Kind of like, I think I'm just going to, piggyback on what Janet's saying, because I will tell you, there's a lot of good doctors and a lot of good nurses and pharmacists, all kinds of healthcare professionals over the last 3 years. They just got out.
Mm-hmm.
And they are so burnt out in healthcare because of what's happened. And it's too bad, because those are some of the best ones that left.
Right.
And we need good doctors. We need good nurses.
Mm-hmm.
So we need a good place for them to have their own freedom to take care of patients, instead of being told by administrators how to take care of patients.
Right. And that's what's exciting to us too, is I just pray that those people who've been looking to get back in are the ones that, are able to come and see alongside us as we build this community and just work alongside us as hard as they can.